Welcome to Chew on This. With the 2025 budget speech coming up, we're talking about the Health Promotion Levy and how it can support expanding social protection. Global health experts say obesity is a key threat to national and global health. In South Africa, we have the highest prevalence of obesity in Africa. The government introduced the Health Promotion Levy, HPL, in 2018 to deal with the shocking numbers, becoming the first country in Africa to do so. We face a nutrition crisis, with over 1 in 4 children being stunted and nearly 5 million living below the poverty line, while 1 in 8 children under the age of 5 is obese or overweight. Many of these challenges require financial intervention. Health taxes are a good opportunity to raise much-needed funds. It's estimated that the HPL generated close to 8 billion rand. In the 2018-2019 year alone, the amount was 3.2 billion rand. While National Treasury does not ring-fence the money it generates from the HPL and other health-related taxes, such as tobacco and alcohol, health advocates argue that there are advantages to earmarking such taxes for specific social protection programs. The National School Nutrition Program and social grants are instrumental in ensuring that children's needs for food and other essential services are catered for. By prioritizing funding for social protection programs, we can create a healthier and more equitable society.
Nou dan is aan ik zie met de eet nie. As ek moet eerlik wees, gaan die kinders groenvrugte by die skole gaan kry. Want ek kan dit nie bekostig om vrugte te koop om vir hulle vrugte te gee nie.
Khulu nabo babona bayaku-enjoy naxa sesibaphekela sibaseva. Bayakuthanda bayaku-enjoy umuntu acele more uba kukhona omkhulu. So kuyanceda kakhulu urhulumente.
What is the state of health taxation policies in South Africa? How can taxing unhealthy products ensure more social protection? What should the HPL be used for? And what strategies can we use to allocate more funds adequately? Today, we talk to Khanyisa from Section 27. Welcome. Corne from the University of Cape Town. Baone from Priceless at Wits. And lastly, Angelika from HEALA. Corne, you have taught thousands of young people and who are now economists, but your unit in particular, you look at the economics and tax on products like tobacco. Talk to us about the importance of health taxes as health promotion tools.
Yes. So one of the first rules of economics is the law of demand. You get taught that if you do economics 1 in your second or third week. And basically what the law of demand says is if the price of cigarettes or the price of any product goes up, the consumption of that product will decrease. And if the price decreases, consumption is going to increase. And what we see is that that is particularly true in South Africa's case for cigarettes. During the 1970s and the 1980s, the inflation-adjusted price of cigarettes were decreasing, and we saw a huge increase in cigarette consumption during this period. From the beginning of the 1990s, the government implemented a very rigid and strict tax regime where they were increasing the tax on cigarettes on a very, very rapid basis. And as a result of that, the price of cigarettes increased. And as a result of that increase in the price of cigarettes, we see that there's been a very significant drop in the consumption of cigarettes over time. What we also notice is that the same principle of health taxes also applies to alcohol. It applies to sugar-sweetened beverages from 2018 onwards. And what we see is that by increasing the price of sugar-sweetened beverages by imposing a tax on them, basically what you're doing is you're trying to dissuade people from consuming those products. And what we see, and the evidence shows this, that since 2018 there has in fact been a modest decrease in the consumption of sugar-sweetened beverages.
Angelika, given what Corne has just outlined, why, in your opinion, is taxing unhealthy products an absolute non-negotiable?
I mean, firstly, in South Africa, we know that there are so many people living with diabetes, obesity, and all of these diseases that are really causing huge health issues. And we need a lot of interventions to be working together to be able to actually combat these non-communicable diseases and this health crisis that South Africa faces. And we know that something like the Health Promotion Levy, that has now been around for quite some time in South Africa, has actually been positive. We've seen a reduction of sugar beverages drunk, but we're even saying that this tax should be expanded to fruit juices. We know that fruit juices are not perceived to be unhealthy by a lot of consumers and a lot of people. They're also often given to children. We know that they've got the same types of free sugars and things like that sugar-sweetened beverages have that are bad for your health.
Talk to us about, in your opinion, and the work from Priceless about the health benefits as well as the reduced consumption we've seen.
Okay, so I think the health benefits of the sugar-sweetened beverage or tax on sugar-sweetened beverages is, as Corne said, it decreases consumption. And as he said, there's been numbers show a modest decrease since 2018. I think one of the other benefits is that on a more population level, and as well as the benefits for government and public health, is that it has run-on benefits in that it decreases the impact on the public purse. Particularly if we think about how, government is now working on trying to transition to things like the NHI, the National Health Insurance. What we want to do is implement these types of taxes, because what they do is they have an effect on decreasing impacts on health, and so then in the long term decreasing the burden on public health institutions as well as public health budgets. And so I think that the preventative approach is actually a very cost-effective approach.
Experts warn that nearly 5 million South African children live below the poverty line, and a lack of adequate nutrition in the early years of a child's life is one of the leading causes of stunting. We travel to Postmansberg in the Northern Cape, where food insecurity is high. Let's have a look.
I am 27 years of age. I'm a mother of 4 boys. The first ones are twin. The second one, or should I say the third one, is another boy, and then the baby. No, the biggest challenge that I had raising the twins was that I couldn't breastfeed at the time because I was on medication, chronic medication, and according to the doctors, they were going to affect the baby's health. So I had to bottle feed them. But then I can tell the difference between them and the current baby that's breastfeeding. There's a huge difference in terms of the body size and all that, the weight and everything.
Ek is unemployed op die oomblik, sowel as my man. Ek is getrouwd. Ek het 7 kinders, waarvan die baba 8 maande is. 7 kinders is baie moeilik, so ek moet hulle almal voed. En daar's 'n babietjie. Ons kom nie by melk uit nie, ander kere kom nie by kimbies uit, ander kere nie. Jy kom eens by klere uit, die never mind klere en skoene, so dit is baie maar 'n bietjie 'n struggle, maar 'n bietjie.
I would say back then it was easier for me to feed them. But now that I've added 2 more kids into my family, it means that I now have to spend more money to get them fed. Because now the prices of food going up and living expenses going up as well, it became difficult because now the grant money that I receive, I would say, is not enough for kids.
Nou en dan sal my man, hy doen DSTV's, hy kan dit ook doen, so hy werk met these jobs as well. And basically is dat nou en dan is baie moeilik, want nou en dan is daar nie iets om te eet nie. Het is maar net so honger gaan. As ek moet eerlik wees, gaan die kinders groenvrugte by die skole gaan kry. Want ek kan dit nie bekostig om vrugte te koop, om vir hulle vrugte te gee nie. Ek moet nou net struggle dat hulle kan sê om te eet. En so op die oomblik kan ek nie dink aan as dit gesond of as dit ongezond nie. Want ek kan nie, as ek moet gezond koop, dan sal ek nie daarby uitkom nie. So ek moet nou net fokus ons moet eet. So vrugte, groente, daai goed is luxury vir my.
Khanyisa, The reality of Erika and Marche are that story of millions of other mothers in South Africa. What's your thoughts on it? And of course, you have also been advocating about the expansion of the National School Nutrition Program to far-flung communities.
Yes, so that is the reality of most South Africans, particularly in the rural areas and within the rural provinces of the country. The school nutrition program feeds about 9 million children, close to 9.7 million children in South Africa. And the government spends about 9.7 billion rand on the program. It's been alive since 1994, and so it's clearly something that has to go on. In fact, our courts have as recent as 2020 confirmed that the right to a basic education includes the right to nutrition, as well as the rights of children to have things like textbooks, scholar transport. All those rights are the right to basic education. And so the right to school nutrition doesn't only just speak to feeding the child, making sure that the child is fed, but also allows children to concentrate in school. It allows them to grow. It allows them to be excited about even going to school, like things like being excited about going to school, being punctual. Those things are actually things that it improves. And making sure that that food that the children are fed in schools is adequate in terms of its nutritional content also allows them to grow in a particular way that allows them to retain the information that they're getting at school. And so our advocacy at Section 27 has been the expansion of this program to make sure that a lot more children are incorporated in it and a lot more children can benefit from it. We think it's absolutely vital, and obviously, as the courts have found, it's integral. It cannot be separated from the right of nutrition under Section 28 of the Constitution.
Mm-hmm.
In that same case, Khanyisa, the courts found, one, that the rights of children are immediately realizable, and so the right to access a program like the NSNP or the National School Nutrition Program was something which government had an obligation to fulfill immediately, contrary to other rights which may be progressive, like the right to housing or something like that. So one is that's the most important thing, and secondly, that that same court case also found that government has an obligation to feed children where parents are unable to, that the state has an ultimate obligation to fulfill that. And so I think if we kind of take a step back and look at, or take it back to the Health Promotion Levy, taxes on their own work, but they work better when they work in concert within a framework of policies that target the food environment. And one of those things is promoting healthier eating, which is one of the ways in which the NSNP can do that and target particularly younger children and have a positive impact on them into their adolescence.
Angelika, you agreed wholeheartedly with Khanyisa and Baone. Expand on kind of the social protection programs that the health, the HPL can assist and promote.
Yeah, I mean, if we look at the Health Promotion Levy, we shouldn't really be seeing it as just a health promotion levy. It's like this opportunity for the National Treasury to really utilize the revenue that's generated, the health inequities in our country. So many things are positive towards this levy, and it shouldn't just be seen as we taxing sugar-sweetened beverages and that's that. I mean, the National School Nutrition Program is an incredible program. And if we can somehow make sure that more children are fed, these stories that we hear, like that we saw on the screen now, of mothers that are struggling, to think that fruits and vegetables are a luxury, I mean, that's heartbreaking, because we go to the shops and again, we can just pick up some of these packaged foods that are so much cheaper and so much more accessible. And these are the types of things that the National Treasury, it would be wonderful if they could start thinking it through in that way, of not seeing it as just a levy and not seeing it as something that just has been existing for a few years, but really starting to think how we can utilize this as best we can in the country.
Corne, so obviously you're a numbers man, but I mean, we do know that health advocates have been arguing for ring fencing so that more children, not only in the Northern Cape, but across the country can be fed, and younger children can be fed more nutritional food as well. I know that there's different arguments about it, but don't you think it's time for us to actually ring fence the money?
So if I was here standing as somebody from the National Treasury, I would say absolutely not. And the Treasury typically says we don't want to distort, and that's the words that they use, we don't want to distort the budget-making process. If something is worthwhile, then it is worthwhile to do it through the general budget where everybody competes for that kind of money. So that's typically the view that the National Treasury would take. We do know from international experience that many countries have in fact earmarked health taxes in a variety of ways. Countries that come to mind are Thailand, Panama. There's earmarking that's happened in Botswana. Some of that earmarking has been done incredibly well. Other earmarking, sometimes you say afterwards, it might not have been the best possible way. But if earmarking is done well, what it does is it buys public support for something. People are saying, why am I paying the taxes on the cigarettes? Well, it only goes into a general pot. That is quite different than if you say, let's take the money that goes into a particular pot and use it for something that we can show really, really good results for. And if I can just add on to what my colleagues over here have said, not so long ago in The Economist, there was a the front page was how to increase the intelligence of the population. And how do you do it? Through good feeding, especially in the first 1,000 days of life. Of course, kids at school are not in the first 1,000 days, but the principle stands, and that is that by good food and good eating habits, you are able to develop brains that are in a very, very vulnerable early stage of life. You can develop those brains and effectively increase the average intelligence of the population like that.
Great point, Corne, which brings us to now. Every day, the National School Feeding Program, the NSNP, feeds 9 million children from disadvantaged communities, enabling them to concentrate on their education. We spend some time with Apeswa in the Eastern Cape, who relies on a meal from the NSNP they receive at school. Have a look.
Akuba abantwana abangafani even namakhaya abo. So it's a privilege for abantwana abalapha abakufumana ukutya. For those abangakhona ufumana emakhaya like okupheleleyo every day. So iyancedisa kakhulu nabo ubabona uba bayaku-enjoy naxa sesibaphekela sibaseva. Bayakuthanda, bayaku-enjoy umuntu acele more uba kukhona omnye ukutya. So kuyanceda kakhulu urhulumente. First days, baphekeli full meal, rice, chicken, cabbage, and carrots.
The parents who are working as meal servers, they are also the parents who are biological parents of the children that are in our school. Basically, the money is coming from the department, is being transferred by the Department of Education straight to our bank accounts. Yes, then we augment some of the funds with fundraising from the school, because not everything is catered from that amount. It's only, I think it's food, it's fuel, then it's salaries for the meal servers.
So sente ukuthi ukutya kona kuyamncedisa umntwana wami. 1, uyaperform esikolweni kakuhle. 2, every day funeka ebheke esikolweni akayisonqena esikolo because ayayazi into yoba uzawufika phaa kube ngathi kokwabo esikolweni. Athi olu hlobo adla ngotya ngalo kokwabo. Abuye azodlala ibhola zakhe ke even more.
Ukubulela more than anything, because we don't take it lightly into yokokuba abantwana befumana ukutya.
The nutrition program has a lot of advantages in our schools. For an example, e-learning and teaching has improved. Absenteeism also, we no longer have a challenge of absenteeism. The kids are always keen to come to school.
Khanyisa, a healthy, nutritious meal. We're feeding millions, as you pointed out, 9 million, but we could be feeding more, right?
Exactly. In fact, the government has taken on an expansion of the program, or is considering an expansion of the program. They're currently piloting the expansion of the program into ECDs, or early childhood development centers, and also piloting offering breakfast meals at schools. So currently they only offer one meal, which is the lunch meal, but they're considering offering breakfast meals as well, because a lot of the children rely on these meals as their only form of food for the day. And so if they were able to get the additional meal, breakfast meal, they would be able to, like the principal was saying, come to school earlier, be excited for school, concentrate for longer periods of time, retain the information.
Angelika, we hear the argument, and of course we need money for it, and a minimum expansion of 20%. Talk to us about it.
Yeah, I mean, so since the Health Promotion Levy was enacted in 2018, the Treasury ended up making it about at 11%. But unfortunately, we've seen in the last few years, there's been no annual increases of this. There was a promise of it 2 years ago, and then they retracted it once we assume industry had some say in that. And they actually have made a promise that they're going to do some kind of increase in the budget speech of 2025. But, I mean, at this stage, because there's been no increases, the tax has eroded to a level below 10%.
Sorry, can I jump in there? It's been eroded by inflation.
Inflation, yes. Sorry, it's been eroded by inflation, and now it's below 10% with the recent calculations that have been done. And I mean, HEALA took to the streets. We went out to the National Treasury, we did a protest, and it was the first time we actually got responses from them of why they haven't done any kind of increases, what their story is. And basically they said that because the Health Promotion Levy is within that 10 to 20% bracket, they don't need to increase to 20. But the reality is, because of this inflation erosion, there has been this decrease to below 10%.
May I come in?
Yes, Corne, yes, you, the numbers man, talk to us about.
So I think it's important to realize, how does this tax work? So initially, when the National Treasury made the proposal was about 2.3 cents per gram of sugar in beverages. Then, under pressure from the SSB industry, the formula was changed, and now the first 4 grams per 100 milliliters are tax exempt. And what we find is that only past that point does the tax then become applicable. And there are strong incentives over here for the industry to avoid the tax. It's not to evade the tax, it's completely legal to avoid a tax. And the way that they've gone about it is by reducing the sugar content of products to just below 4 grams per 100 milliliters. So if you were to go and look at a sort of typical fizzy drink, you'll often find that it's 3.8 or 3.9 grams per 100 milliliters. Now one could argue, is that a good or a bad thing? Because the question is, what has that sugar been replaced by? Has it been replaced by something better or by something worse? I'm not a nutritionist, so I can't judge that. So that's a nutritional type of question that needs to be addressed over there. Now, the question that the Treasury should ask is, should we not reduce that threshold from the current 4 grams to 2 grams or to 0?
Finance Minister will be doing his budget speech in the next few days. A final thought from each of you to the Minister of Finance.
Yeah, so I think in this climate of austerity that we're seeing in the country, and seeing the decrease in the investment that government is making into NSNP, it would be great to see that there is an understanding of how vital this program is to the 9.7 million families that it supports, and how vital it is for the continuation of the growth of those children, to prevent things like stunting, to make sure that the government meets its obligations, its constitutional obligations under Section 29 and Section 28 of the Constitution. So it would, for us at least at Section 27, we would like to see that being translated into the budget, perhaps putting more money into NSNP, acknowledging that just because they've done the piloting, it doesn't end there, that they need to extend the program to accommodate breakfast, to accommodate early childhood development centers, because they understand how vital this is to children, to the growth of children, to the ability to consume and retain information at schools.
Corne?
I think there's an understanding that the health taxes, that's taxes on tobacco, taxes on alcohol, sugar-sweetened beverages, are not just bringing in money. They do bring in money. They bring in a fair amount of money, probably in the order of about 50 billion rand on an annual basis. So there's a lot of money that's going around. But I think the critical thing that we need to understand is that you want to influence behavior. And if you are influencing behavior, you are saying to the public, by increasing the excise tax on these products, that these are bad products, and you are changing the relative prices and making the bad products more expensive and disincentivizing people to purchase them, and by implication the other products become relatively cheaper. Of course, to go for something like a subsidy, I don't think that the government is quite there, a subsidy on healthy foods, but in the long run that might be something that the government should be thinking of.
I think I would like to see a bit more commitment to creative problem solving from the minister. So for example, something like coordinating with the Department of Agriculture to promote maybe partnerships with like rural farmers to kind of supplement the NSNP. I also think I'd like to see a bit more of a neutral and objective approach where government really is supposed to be balancing contrasting interests, and that balance should be equal. And so if anything, actually, it should promote health and children over the interest of investors or business. And I would like to see the minister being more, should I say, committed to taking that approach and kind of really applying his mind to how he can resolve those types of issues.
Angelika, final thoughts?
Yeah, so I mean, this budget speech is really important. The first thought about the Health Promotion Levy specifically is that the Treasury has actually promised an increase in this 2025 budget speech. So firstly, we're really going to be keeping an eye on them, whether they do that. We also want to make sure that there is a commitment to the expansion of fruit juices to the levy, as well as Prof has mentioned, this discussion on what should be this reduction of the threshold, because we really need to make sure that this health promotion levy is being utilized in the best possible way. Hopefully this increase that we'll see will be this minimum 20% that we're advocating for, and just also on all of the reflections of everyone else. I mean, whatever the Treasury decides to use this money for is still up to them, but it really is important for us to carry on advocating for children's rights, children's nutrition, and really trying to better these social protection measures that South Africa has.
Thank you very much for your insights, because this is the end of season 1. Thank you. Now, research has shown that our children are starving, and inadequate nutrition has lasting effects on children's minds and their functioning in school. With our dire socio-economic realities, families go to bed without a meal. The National School Nutrition Program, despite its challenges, is a game changer. It provides nutritious meals to millions of children in schools across the country, helping to alleviate hunger and improve academic performance. By addressing the issue of food insecurity, the school feeding program plays a crucial role in breaking the cycle of poverty and improving the overall well-being of our children. The HPL, if increased or expanded, can ensure more children have a healthy, nutritious meal so they can benefit more people who need help in our society. Sign the petition to increase the health promotion levy to a minimum of 20% on all sugary drinks on HEALA.org.